Smoking in public places is now illegal in Uganda. The law is cracking down on young smokers. The legal age limit for smokers is now 21, and buying and selling single cigarettes is no longer allowed.
But to protect especially the young people, we have certain provisions we have put there to regulate the sale and supply of tobacco. So that's why you find we are restricting selling of tobacco to people below 21 years, because by that age, many people are still dependent, many people are still in school. So we have to protect these young people.
Like Uganda, Tanzania has already banned smoking in public places. And the World Health Organization is calling on all countries to ban all forms of tobacco advertising to reduce numbers of users. Uganda's new law also requires an end to open tobacco advertising.
All cigarette packets, irrespective of who has manufactured, get the same color, a dark color not attractive. They are not allowed to put any information about the company or what, but can only write their brand name. And the rest of the space is dedicated to putting health warnings in pictures and in words.
In Africa, Ghana and Mauritius are ranked as the countries where most progress in banning tobacco advertising is being made. The ban also includes shisha smokers. Shisha is a trend among young people in Uganda where flavored tobacco is laced with drugs, such as cannabis, and smoked using pipes. But some Ugandans think the new law will not work out.
Government or the Ministry of Health should have thought of why do people take these things in the first place and tackle those issues. People are troubled. People are living a life of uncertainty. People are trying to get away from the reality of oppression around them. So you dealing with a one ingredient, cigarettes, doesn't solve the problem. People are going to more deadly things if you take away cigarettes.
The government says it designed the law to protect people from harmful diseases caused by tobacco. In Uganda, there are no designated areas for smoking, and enforcing the smoking ban could be difficult. In East Africa, Kenya has managed to allocate smoking zones, and though campaigners say enforcing the smoking ban may take some time, they are positive that Uganda will one day achieve a smoke-free environment. Isabel Nakirya, CCTV, Kampala.
While staying with the World Tobacco Day, for more on this topic and smoking bans, we're now joined by Mr. Joel Gitali. He is the chair of the Kenya Tobacco Control Alliance. Mr. Gitali, thanks for joining us. Now, of course, in light of World Anti-Tobacco Day and, of course, the global anti-tobacco efforts that are being pushed by the WHO, just tell us about your organization and its main objectives here in Kenya.
Thank you. My organization is Kenya Tobacco Control Alliance, KETCA, as you say, and I'm the chair. So this organization is there mainly to bring together civil societies that work on tobacco control in the area of coordination. We coordinate their activities so that we move together. We are doing the same thing with the same objectives. The other thing is to work with the government to ensure that the civil society organizations working on this, because this is a health issue, we must work with the government and then with other partners like WHO and other partners from outside. They could be global NGOs or even governments of other countries and international NGOs. Yeah, then the other one is ensuring participation of CSOs in policy development, implementation, and enforcement.
Right. Well, let's just go back to your previous point where you mentioned that this, of course, is a health issue.
Yes.
On the other hand, though, it must be noted that the tobacco industry does contribute to the economies of various African countries. How then, as an organization, do you balance this, the health concerns versus the economic value of the tobacco industry?
Thank you. Research has actually proved that tobacco industry does not contribute to the economic welfare of these countries, because for every 1 shilling we get in form of tax, we use 3 shillings to mitigate the effects of tobacco So we are using more. Environmentally, tobacco has got very bad effects. Then when you look at the social lives of the people who grow tobacco, you look at the health of these people and even the users of tobacco and the second-hand smokers. The effects are so bad such that you cannot even talk about what they give.
Now, you mentioned earlier that your organization works closely with civil society organizations, with government and policymakers. But what about manufacturers and industry players? Don't they have a role too in trying to mitigate the dangers of cigarette smoking?
Now, you know, when one is in business, one would like to reap maximum benefits at the lowest cost. And that is what the tobacco industry is doing. That they would like to get as much as possible, and yet they spend as little as possible. So if left to themselves to regulate themselves, they will not do much. Yeah, in fact, this has been proved. In the past, they have advertised, and when they advertise, you see that they are using falsehood. Like when they show that sportsmen can do very well when they smoke. Is that scientifically true? So left to themselves, they can do very bad things. They have given false information about taxes. They have given false information about the contents of tobacco. So it cannot be left to them, and they cannot do anything positive.
All right, we'll have to leave it there. But thank you very much, Mr. Gitali from Kenya's Tobacco Control Alliance, live with us here in studio.